speaking specifically about the breast lift, everybody says, what type of incision do I need? Do I want a donut? Do I need an anchor? Do I need a lollipop incision? What it really boils down to is how much extra skin there and how far we need to move the nipple. So the more we need to move the nipple up, unfortunately, the bigger the incision. The bigger the breast, the more skin there is, the bigger the incision needs to be. So the first one is what we call a donut mastopexy. Some people call it a Bonelli mastopexy, where there's just an incision just around the nipple. Works fine if we're really just trying to reduce the size of the areola, but if you try to do any lift there, everything just stretches back out because all the tension's around the areola. So it's rare we actually use that Bonelli or donut lift to do a mastopexy or provide any lift at all, because what happens over the next 2 or 3 years, everything stretches back out. You end up with great big areolas, bad scars, and a breast that really didn't improve. And all you've done now is added a big scar to a breast that looks just like it did before. So the next step from there is a lollipop lift or a vertical mastopexy. That's where we take and we add a vertical incision to the incision around the areola. Now, the purpose of that vertical incision is to take the tension off the areola so that it doesn't stretch back out. People say, well, I don't want a vertical incision because you'll see it. Believe it or not, that scar actually heals the best of all 3 incisions. It really looks very nice. Keep in mind when you look at pictures on the internet, most of those pictures are done between 2 and 3 months after surgery. As the scar heals, it begins to get pinker and pinker and pinker through the healing process. That peaks about 3 months after surgery, and then it begins to fade. It takes 6 months or a year for a scar to completely fade away. But we have lots of scar programs and scar tapes and a whole scar management program we put patients on to help those scars fade very nicely. Now, the third type is the anchor-shaped incision, or some people call the wise pattern incision. That's really for a bigger breast. We got to remove a lot of skin and tighten everything back up. So that third incision is an incision that comes underneath the breast. You still have to have the incision around the areola and vertically, but now we're taking and tightening all that skin up. We're shortening the distance from the nipple down to the fold in order to make the breast fit into clothes and fit into bathing suits better, because there's certain measurements that are very predictable that people perceive as being pretty. We use those same measurements to recreate the new breast, the nipple position, so it looks aesthetically pleasing, and those happen to be the same measurements that clothes manufacturers use to design and make clothes. So the breast will fit into clothes better, and you'll find it's much easier to find things that fit and are tailored more towards your body type.